So New South Wales recorded 78 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and one new case was acquired overseas in the 24 hours to 8 p.m. last night. Tragically, there has been a death of a woman in her 50s who was confirmed COVID case. She was a resident in southwestern Sydney and a close contact of a COVID-19 case, and can I just extend my sympathies to her, her family and her friends at this most difficult time. I think this now leads me to my segue to the fact that COVID is a very serious disease. We are seeing more hospitalisations, more admissions to ICU, more people on ventilators. We have to stop the spread of COVID. To do this, we all need to work together. We need to limit our movements. We need to consider whenever we leave our house that anyone with us, anyone we come into contact with, could convey the virus. So whilst it is in human nature to engage in conversation with others, to be friendly, unfortunately, this is not the time to do that. So even if you run into your next door neighbour in the shopping centre, in the Coles, whilst you're at Coles or Woolworths or Aldi or any other grocery shop, don't start up a conversation. Now is the time for minimising your interactions with others. Even if you've got a mask, do not think that affords total protection. We want to be absolutely sure that as we go about our daily lives, we do not come into contact with anyone else that would pose a risk. Obviously, there are essential work. There is work, and I shouldn't use that term essential. I understand that work is essential to everyone, and probably we need a new word other than essential. But I think the community understands what we mean. We need to maintain our food services, logistics supply. We need hospitals and health services to be operating. But now is the time to really ensure that everyone complies with the spirit and intent. And the spirit and intent of the public health orders is to reduce mobility, reduce the opportunities for anyone to come into contact with anyone else. And so that responsibility is now firmly on workplaces to take those actions. And clearly we have seen the closure of a number of workplaces which facilitates that as well. There are some areas of increased concern. So in terms of my assessment of the situation at the moment, is we still see cases in the Fairfield local government area. And can I just thank that community? I had the opportunity to review the testing numbers today, and that community has responded. So thank you. But unfortunately, we have to continue to sustain those high testing rates in that community and continue to practice those COVID-safe behaviours of staying at home, not visiting friends and family. I am concerned about the emerging risk in Canterbury-Bankstown local government area. So that covers Belmore, Lakemba, Punchbowl and Yagoona. And my reason is that there are a number of cases there, and there's also a number of exposure sites in that area. Also, I can confirm today that one new case was linked to the Al Sultan butchery in Lakemba, and it's included in today's numbers. So again, please be aware if you've been to that butcher, the Al Sultan butchery, please make sure that you follow the public health advice, urgently get tested and isolate, as well as your household members. The other areas that we have seen cases demonstrating we've got missing links. So we're finding unlinked cases in other areas, and that means that there's chains of transmission we're yet to crack and yet to break. That engenders quite significant concern to me. So also areas around Hurstville and Cogra, Marylands, Greystanes, Auburn, Guildford, Mount Druitt and Rooty Hill. I would also like to update you on the data in relation to the testing capacity. It has been pleasing to see those high rates of testing sustained, and we are working with the private pathology to ensure that those turnaround times and the throughput are maintained. And finally, another action I want to make it clear is permitted under these lockdown provisions is going out and getting a vaccine. You shouldn't go if you're a close contact or you've been designated as a casual contact, but please go and get vaccinated. There is access to vaccines, and the vaccines are incredibly effective at preventing hospitalisation and death, and they are the way out. And yes, we haven't got enough vaccine at the moment, but we have got some vaccine which is accessible, and I would urge everyone to go forward for your second dose of AstraZeneca, or also your first dose, or if you're eligible for Pfizer, to take up that opportunity. Thank you.